thoracotomy using a spreader to open her chest and manually massage her heart. He orders 10 units of blood and 10 units of plasma. He injects epinephrine directly into the cardiac muscle and applies internal paddles to shock her heart. The monitor remains a flatline. Dr. Latham calls the time of death at 16:22. Connor stands over the woman who killed his father and then committed suicide to ensure he would never forget her. The trauma is irreversible. Connor finds Dr. Latham and submits his resignation on the spot. He refuses to offer an explanation. He turns his back on the operating room and walks out of the hospital, leaving his career and the blood-stained scrubs behind. Dr. Manning clashes with the hospital administration over her aggressive treatment of a young patient. The boy's parents refuse all medication, but Manning is certain the child is dying. She takes an extreme step. She locks the boy inside a treatment room. Dr. Manning clashes with the hospital administration over her aggressive treatment of a young patient. The boy's parents refuse all medication, but Manning is certain the child is dying. She takes an extreme step. She locks the boy inside a treatment room and bars the door. Ignoring hospital protocol and the law, she forces an IV into the child's arm to administer medication against his parents' will. The hospital board issues a formal warning. The parents demand her immediate arrest. While Manning faces an internal review, the boy's condition takes a violent turn. He begins coughing up blood. The situation escalates from a legal dispute to a medical emergency. Police officers arrive at the hospital to take Manning into custody for assault. She ignores the police. Manning pushes past security and returns to the boy's bedside. She performs an emergency endoscopy, threading a camera probe into the child's airways to inspect the respiratory damage. The monitor reveals the truth. The boy's lungs are suffering from massive internal bleeding and inflammation. It is not pneumonia. It is granulomatosis with polyangiitis, a rare and lethal autoimmune disorder. Manning initiates plasmapheresis to filter the toxins from the boy's blood and regulate his immune system. The blood washing procedure stops the hemorrhaging immediately. Faced with the fact that Manning's defiance saved their son's life, the parents withdraw their lawsuit and the police drop the charges. The hospital board cancels the disciplinary action. Manning leaves the ward, having broken the law to ensure her patient survived. David Bridges arrives at the emergency room with a ruptured spleen and massive internal bleeding following a high-speed car crash. His parents, devout Jehovah's Witnesses, immediately present a no-blood card and refuse a life-saving transfusion. They stand by the bed and pray while their son's blood pressure collapses. Dr. Halstead refuses to accept the medical stalemate. He reviews the toxicology report and discovers David's blood alcohol level is 3 times the legal limit, accompanied by traces of marijuana. Halstead then unbuttons David's gown to reveal a Holy Trinity tattoo on his chest, a symbol that directly violates the core doctrine of his parents' faith. Halstead presents these findings to the surgical team as evidence that David has abandoned his religion. He argues the no blood card is an outdated document signed when David was a minor and no longer represents the patient's current life. Based on this logic, the doctors override the parents' instructions. They rush David into surgery and administer a full blood transfusion. Believing their son is now spiritually tainted, the parents leave the hospital. When David regains consciousness, the medical success results in a total psychological collapse. He reveals the tattoo was a youthful mistake he intended to remove, and the alcohol was a lapse in a journey toward repentance. He was desperate to return to his faith. By forcing the blood into his veins, the doctors have permanently excommunicated him from his family and his God. David screams in his bed, realizing that his physical survival has cost him his eternal salvation. A Domino transplant binds 2 families in a life-for-a-life agreement. The plan is clinical. One family provides a kidney to save the other's son, and in exchange, they receive a compatible organ for their own. But the arrangement shatters when Dan Schiller dies on the operating table from sudden complications. The medical team performs chest compressions until the lead surgeon calls the time of death. Bill Schiller, the grieving father, immediately attempts to void the contract. He holds medical power of attorney and issues a formal retraction of consent while his wife is still under anesthesia. He demands the surgeons stop the procedure. To Bill, the deal died with his son. He refuses to let his wife lose an organ to save a stranger when his own child is gone. Inside the operating room, Dr. Marcel stands over the donor. The kidney is already detached and sitting on ice. The hospital's ethics committee and legal counsel convene instantly to resolve the deadlock. They review the signed agreements. The committee delivers a cold, factual verdict. Because the kidney has already been removed from the donor's body, the hospital is now its legal caretaker. They rule that the donor's original intent was to save a life, and that mandate remains binding. Bill's grief does not grant him the right to terminate a life-saving process already in motion. The hospital overrides the father's retraction and orders the transplant to proceed. Mike, the second patient, receives the organ. One family prepares a funeral, while the other receives a second chance at life, forced through by a clinical, legal mandate. Jordy arrives at the emergency room following a car accident. He is 16 years old and has Down syndrome. While initial exams suggest minor whiplash, Jordy reports a persistent tingling sensation in both hands. Dr. Halstead orders an MRI to investigate further. The scan reveals atlantoaxial instability, a congenital condition where the top 2 vertebrae are misaligned. This instability makes Jordy's spinal cord extremely vulnerable to injury. The medical team presents the father, Russell, with 2 options. A halo vest offers a safe recovery, but permanently ends Jordy's career as a figure skater. Surgery can can stabilize the spine and allow him to return to the ice, but it carries a high risk of permanent paralysis. Fearing for his son's safety, Russell chooses the brace. He refuses to authorize a surgery that could leave his son in a wheelchair. Jordy's reaction is immediate and desperate. He refuses to accept the brace, pleading with his father to let the doctors fix him. He shows his father a video of his recent skating performance. On the ice, Jordy moves with a precision and freedom he does not possess on land. He tells his father, "I want to fly." Russell watches the footage and recognizes that his son's identity is tied to the rink. He realizes that by choosing the safe path, he is taking away the only thing that makes Jordy feel free. Russell reverses his decision and signs the consent forms. Dr. Abrams performs the high-stakes surgery. The operation is a success. Jordy retains his mobility and regains the right to return to the ice. He is no longer a patient. He is an athlete again. Officer Johnny Bell is rushed into the emergency room with a gunshot wound to the abdomen. He is hailed as a hero for drawing fire away from a 10-year-old girl. Surgeons Ethan Choi and Crockett Marcel move him to the operating room to retrieve the bullet. During the procedure, they find the fresh round, but they also discover a large, infected mass near the cecum. They cut it open and pull out a piece of brown, weathered material. It is not medical gauze or a fragment of bone. It is foam from a car seat. The doctors run an X-ray. The imaging reveals entrance and exit scars on Johnny's flank that were never reported. There is no record of a prior shooting in his medical history, and his police partner is unaware of any past injuries. When Johnny regains consciousness, Choi and Marcel confront him. Johnny initially claims the scars are from a childhood accident involving a toy sword. Choi drops the car foam into a metal basin. He states the medical fact. This material only enters a body when someone is shot while sitting in a vehicle. The hero's composure collapses. Johnny admits that at 17, he and a friend attempted to rob a liquor store. The owner fired back, killing his friend and wounding Johnny as he sat in the getaway car. He never went to a hospital and never reported the crime. He spent the next decade reinventing himself as a police officer to atone for the robbery. Despite his recent bravery, the doctors inform him that a gunshot wound is a mandatory report. The past is no longer hidden. The hero is a fugitive. Doctors Choi and Archer arrive at a collapsed renovation site to find a worker trapped in the basement, his abdomen mangled by a circular saw. The scene quickly shifts from a rescue to a war zone. A gang fight erupts in the surrounding neighborhood, forcing the police to initiate a total lockdown. No ambulances can enter or leave. The basement becomes a makeshift field hospital where the doctors must operate with limited supplies and no backup. The patient is eviscerated and losing blood rapidly. Archer identifies a severe liver laceration. To stop the hemorrhage, they must perform a Pringle maneuver, manually clamping the blood supply to the liver in near darkness. As Archer reaches into the open wound, the environment triggers a dormant trauma. The dim lighting and the staccato of distant gunfire send him into a PTSD flashback. His hands shake uncontrollably. He loses his focus and his grip on the artery, allowing the patient to bleed out on the dirt floor. Choi recognizes the signs of a combat-induced breakdown. He ignores the chaos and moves into Archer's personal space. He locks eyes with his colleague and delivers sharp, military-style commands to ground him. The psychological shock works. Archer snaps back to the present, regains his steady hand, and successfully clamps the vessel. The bleeding stops, and the patient's blood pressure begins to climb. As the police secure the perimeter, the team hauls the stretcher through the ruins. They exit the basement, having survived a battlefield rescue. Mindy is 18 and dying of a brain tumor. She refuses surgery, terrified that a scalpel will destroy her ability to play the piano. The situation turns critical when she collapses from a massive intracranial hemorrhage. She falls into a deep coma, her brain crushed by rising internal pressure. Dr. Archer sees a legal opening. He invokes a power of attorney, overriding Mindy's previous refusal because she is now unconscious and unable to speak for herself. Archer does not hesitate. He takes a medical drill and bores a hole directly into her skull. The sound of the bit grinding through bone fills the room as he releases the trapped blood. Mindy wakes up, but her defiance remains. She still refuses the full tumor removal, choosing death over the risk of surgical complications. Archer switches to psychological warfare. He sits at her bedside and recounts a story from the Iraq War. He describes being trapped in a dark stairwell, wounded, and surrounded by enemy fire. He talks about the freezing cold of blood loss and the choice between dying in that corner or running through a hail of bullets. It is a calculated move, a story borrowed from a comrade to bridge the gap of her fear. He tells her that being scared is the smartest thing a person can be, but staying in the stairwell is certain death. He promises to stay with her for every second of the procedure. The psychological pressure breaks her resistance. Mindy consents to the surgery. Archer saves her life by weaponizing a narrative, proving that a well-timed story can be as effective as a surgical tool. Jasmine, a young girl, lies in a hospital bed after suffering a stroke. Dr. Scott informs her mother that the cause is sickle cell anemia, which made her blood thicken and clot. This tragedy was preventable. Standard protocol requires annual Doppler scans and daily hydroxyurea to maintain blood cell shape, but Jasmine's previous doctors never mentioned these treatments. Dr. Scott highlights a systemic failure. While cystic fibrosis patients, who are mostly white, receive intensive case management, over half of black children with sickle cell are never screened for stroke risks. In the next room, Dr. Stevie Hammer examines Alicia Russell's x-rays. The images show severe, advanced arthritis in both knees and hips. Stevie notes that Alicia is too young and too fit for this level of joint decay. She asks Alicia directly if she is living in her car. The joint damage is a physical record of sleeping upright in a confined space for months. Alicia cannot deny the evidence written in her bones. Late that night, Stevie enters a homeless encampment under a city bridge. She navigates through trash and makeshift tents to find a dilapidated van. Inside, she finds her own mother. The van is broken, and the older woman is visibly ill. Stevie uses her stethoscope to listen to her mother's congested lungs. The woman has run out of her medication but refuses to go to a shelter or a hospital. She tells Stevie she can handle herself. Stevie is a high-ranking doctor, yet she is powerless to move her mother off the pavement. Identical twins, Gemma and Emma, present a medical anomaly of pathological codependency. Gemma suffers from a ruptured ovarian cyst and internal bleeding. She requires immediate surgery, but the sisters refuse. They demand a dual operation. If Gemma gets a scar, Emma must have one too. They claim to be a single entity and refuse to be treated as individuals. Dr. Charles, the psychiatrist, attempts to break the deadlock through psychological manipulation. He uses their obsession with unity against them, explaining that Emma's remaining ovary represents their shared genetic future. He argues that preserving one ovary allows both sisters to biologically mother a child. The twins offer a silent exchange that suggests agreement. The nurses prep Gemma for the OR. However, the sisters exploit a blind spot in the prep area. Utilizing their identical appearance and clothing, they switch places. The healthy sister Emma is wheeled into surgery while the actual patient remains in the ward. The surgical team induces general anesthesia. Emma falls into a deep sleep. Outside, Dr. Charles observes the sister left behind. Her physical cues betray the deception. He realizes the girl in the ward is the one in pain. Charles bursts into the operating room just as the surgeon lowers the scalpel. He halts the procedure, revealing that the person on the table is not the patient. The sisters use their physical resemblance to commit identity fraud on the operating table. The surgical team freezes as the scale of their sick devotion becomes clear. Director Goodwin shows Dr. Halstead the physical cost of medical fraud, a patient's amputated limb. She presents the data on the VASCOM monitor, an expensive device Dr. Matt Cooper uses with alarming frequency. Cooper bills Medicare 60% more than any other doctor in the region. Goodwin offers Halstead a secret return to the hospital on one condition. He must act as an informant and record a confession. Halstead accepts the mission to reclaim his career. He finds Cooper in the hospital cafeteria and initiates a conversation. He uses a mutual acquaintance to break the ice, pretending to be a disgraced physician looking for a way back into the system. Cooper takes the bait when Halstead suggests they get a drink later. The investigation moves to the operating room. Dr. Crockett is operating on a clinical trial patient when Cooper interferes. He demands the team use the VASCOM monitor, claiming it is the only way to ensure accuracy. Crockett resists, but Cooper persists in pushing the invasive equipment on a patient who does not require it. Halstead watches from the observation deck, documenting how Cooper prioritizes corporate kickbacks over surgical necessity. The tension in the room is not about the patient's health, but about the hidden financial interests driving the procedure. Halstead remains silent, waiting for Cooper to incriminate himself. Halstead monitors a patient using the VASCOM device when she suffers a sudden, unexplained stroke. He suspects the device is generating blood clots and demands its removal. Dr. Hammer refuses, citing the monitor's superior data tracking. Halstead ignores her and pulls the arterial line, risking immediate termination. The patient's condition worsens as her fingers and toes turn cold. Halstead compares x-rays from the morning and afternoon, noting that lung infiltrates have migrated from the left side to the right. He identifies the rare underlying cause as Churg-Strauss syndrome, a systemic vasculitis. The crisis peaks when the patient enters ventricular tachycardia. Hammer reaches for the defibrillator paddles, but Halstead stops her. He realizes the heart is being crushed by fluid in the pericardial sac. It is cardiac tamponade. He calls for an 1/8 gauge syringe. Without waiting for imaging, he plunges the needle into the patient's chest. He draws back the plunger, and the syringe fills with fluid. The monitor immediately shows a return to sinus rhythm. The patient opens her eyes, breathes. Halstead's manual intervention saves the life that the technology nearly ended. He proves the misdiagnosis through physical evidence and decisive action. The high-tech monitor is exposed as a liability, and the patient survives because a doctor chose facts over a machine's output. Avery Quinn is rushed into the emergency room following a high-impact car accident. Dr. Marcel begins the trauma assessment, but Dr. Blake, the chief of transplant surgery, intervenes. She reveals Avery is her daughter and attempts to seize control of the case. In the operating room, Marcel identifies a grade 4 liver laceration. He insists on packing the wound and leaving the abdomen open to prevent lethal pressure buildup. Blake rejects the plan. She uses her rank to overrule him, demanding a primary closure. She sutures the abdomen shut against Marcel's warnings. The consequences are immediate. Post-surgery, Avery's abdomen becomes rigid and distended. Her oxygen saturation drops to 91% as her blood pressure crashes. Marcel diagnoses abdominal compartment syndrome. The internal swelling is suffocating her vital organs. Blake enters the room and tries to block his intervention, suggesting a catheter to buy time. Marcel refused to wait. He orders Blake to back off and calls for a number 10 blade. As the heart monitor flatlines into a continuous alarm, Marcel acts. He does not move to the operating room. He slices through the fresh sutures and the abdominal wall right there in the recovery bed. Blood and fluid erupt as the massive internal pressure is released. The monitor immediately shifts. Avery's blood pressure stabilizes at 112/83. Her oxygen levels climb back to 96%. Marcel drops the bloody scalpel and directs the team to transport her back to surgery. He has saved the girl by violating the mother's orders. Blake stands paralyzed, watching the daughter she nearly killed being wheeled away. 10-year-old Alex arrives at the emergency room with a deep gash on his head. His younger brother, Ryan, hit him with a toy blaster. The parents immediately apologize for Ryan, explaining that his ADHD makes him prone to outbursts. They focus their entire attention on managing the younger boy's behavior while Alex sits silently on the exam table. The situation escalates when Alex suddenly suffers a violent seizure. CT scans reveal a massive intracranial bleed. Doctors diagnose Alex with von Willebrand disease, a rare clotting disorder that turns a minor blow into a lethal injury. He requires immediate brain surgery to relieve the pressure. Dr. Charles observes the family dynamic and identifies a disturbing pattern. Ryan's condition consumes every second of the parents' energy, leaving Alex invisible. He is a glass child, functional, quiet, and completely overlooked by his own family. Minutes before the surgery, Alex makes a confession. He tells the doctors that the injury was not an accident. He intentionally provoked Ryan. He mocked his brother and pushed his emotional triggers until Ryan lost control and struck him. Alex knew exactly how Ryan would react. He explains his logic with chilling clarity. When Alex is healthy, he does not exist to his parents. They are too busy managing Ryan's latest crisis. But when Alex is bleeding, the focus shifts. For the first time in years, his parents' eyes are on him. He orchestrated a life-threatening brain bleed just to end his own invisibility. He chose physical trauma over being ignored. Joe sits at a bar when a younger man bumps into him. Joe refuses to ignore the slight and insults the man. A physical fight breaks out, leaving Joe with a bleeding face and a shattered reputation. His nephew, Dylan, intervenes and insists Joe meet with Dr. Charles for a psychiatric evaluation. Joe is defensive. He claims he only needs medication to manage his stress. During the session, Joe describes the daily habits and home life of a sergeant in chilling detail. Dr. Charles recognizes the signs of stalking and paranoia. He determines Joe is an immediate threat to others. Charles meets with hospital leadership. Despite the risk of damaging Joe's career, the doctor follows his legal duty to warn. He reports Joe's behavior to the police department. Joe is immediately stripped of his badge and placed on leave. This loss of authority triggers a total collapse. Joe armors himself and breaks into Dr. Charles's office. He corners the doctor, brandishing a box cutter and then a handgun. He demands Charles call the department to retract the report and restore his life. The situation escalates until Dylan discovers the hostage crisis. He enters the office and finds Joe holding a gun to Charles's head. Dylan refuses to leave. He speaks to Joe as a nephew, not a doctor, forcing him to confront the reality of his actions. The pressure breaks Joe's resolve. He lowers the weapon and surrenders. Security takes Joe into custody, ending the career of a veteran who could no longer distinguish between protection and pursuit. Hospital administration gathers the staff for a sudden announcement. Wyatt Labs is on site for random drug testing. No exceptions are allowed. Every employee must provide a sample before the end of the shift. Intern Vanessa Taylor freezes. For weeks, she has used Adderall to handle the workload of her residency. A positive result will terminate her career. Vanessa retreats to the balcony, spiraling into a panic attack. Maggie, the head nurse, finds her hyperventilating. Vanessa admits she took a pill that morning and another the night before. Maggie calculates the half-life of the drug and the hours remaining. She decides to assist. She instructs Vanessa to guzzle water and cranberry juice immediately. Maggie then provides a dose of Lasix, a potent diuretic. The goal is purely clinical. Force the kidneys to produce a massive volume of diluted urine to lower the drug concentration below the laboratory's detection limit. The countdown begins. Vanessa drinks until she can barely stand. 30 minutes before her scheduled test, she swallows the Lasix. Her system enters a state of rapid flush. She endures the physical strain of the forced diuresis while maintaining her professional composure. When her name is called, she provides the sample. The laboratory clears her. She has bypassed the test, but the threat remains. Maggie confronts her in the hallway, delivering a final, cold warning. This is the last pill she ever takes. Vanessa stands alone, realizing her career survived on a medical technicality, but her dependency has turned her into a liability. FBI agents arrest Dr. Matthew Cooper for running a multi-million-dollar kickback scheme involving Vascom cardiac catheters. The scandal triggers a massive wave of litigation against the hospital. Sharon Goodwin, the director of patient services, is responsible for the arrest after she bypassed the board to contact the FBI. The hospital board views this as a direct attack on their revenue. They immediately initiate a retaliatory investigation into Sharon's management. The board appoints Randall Shentu, a compliance officer, to find grounds for Sharon's dismissal. Shentu uncovers a private matter. Nurse Maggie Lockwood is the biological mother mother of a resident doctor, Vanessa Taylor. He attempts to use this discovery as leverage, threatening to expose the relationship as a violation of hospital ethics. He pressures Sharon to resign quietly or face a public scandal that would end her career. Sharon does not retreat. She maintains that Dr. Taylor earned her position through merit alone and refuses to let a personal secret dictate her professional standing. Dr. Will Halstead provides the necessary documentation to ensure the FBI's case against the corrupt doctors is airtight. The attempt to blackmail Sharon collapses as the legal reality of the fraud takes precedence over administrative intimidation. At a dinner following the fallout, a disgraced associate attempts to intimidate Sharon one last time. He vows to continue the fight against her leadership. Sharon remains composed, offering no emotional reaction. She looks him in the eye and states a final, cold fact. She will win and he will lose. She walks away, leaving the corrupt leadership to face the legal consequences of their actions. The hospital board demands a liver transplant for Wes Tucker. They need a public relations victory to repair the facility's reputation. They ignore the ethical concerns regarding the athlete's history of alcoholism and push the surgical team into the theater. The operation starts under heavy scrutiny. Mid-procedure, the situation turns critical. Tucker's blood pressure plummets and his heart rate drops to 0. The monitor emits a continuous, flat tone. Dr. Marcel pauses, analyzing the sudden collapse. He identifies the cause. Tucker took beta blockers in secret to manage his pre-surgery anxiety. The medication is now reacting lethally with the anesthesia. The surgical team prepares the defibrillator, they charge the paddles to 200 joules, and deliver the first shock. Tucker's body spasms, but the heart does not restart. They charge again. Another shock fails to produce a rhythm. The room stays silent. Marcel makes a final decision. He calls for a temporary pacer. He works quickly, threading electrodes directly into the patient's chest to force a heartbeat. He bypasses the heart's suppressed electrical system. The device activates. The monitor begins to beep steadily as the heart rate climbs back to 55. The transplant continues. A surgery intended as a PR stunt nearly ended in a fatality, but the team forces the patient back from the edge. Lydia Reed, a professional motivational speaker, sits in a hospital bed complaining of a persistent obstruction in her throat. Without warning, her composure shatters. She erupts into a violent verbal attack on the medical staff, only to transition instantly into a fit of uncontrollable laughter. The doctors watch her, unmoved. They see a woman losing her mind, not a patient with a physical ailment. They categorize her behavior as malingering or a psychiatric crisis. They prepare a psychological assessment to confirm she is faking her symptoms for attention. Dr. Charles refuses to accept the easy answer. He pulls up a video of Lydia from 5 years ago. In the footage, she is articulate and poised. He compares the recording to the woman in front of him. Her current speech is halting, pressured, and irregular. He recognizes the pattern. These emotional outbursts are not choices. They are involuntary neurological events. He identifies the condition as pseudobulbar affect. The underlying cause is bulbar ALS, a rare and terminal form of motor neuron disease that targets the brain cells controlling speech and swallowing. The diagnosis is a death sentence. The room remains silent as the reality of the incurable condition sets in. Lydia does not scream or cry. Instead, the hysteria vanishes, replaced by a cold, steady relief. For months, she was dismissed as a madwoman by specialists who refused to believe her. Now, the speech patterns provide the final, brutal proof. She is not losing her mind. Her body is simply shutting down. She finally has an answer, even if it is the one that will kill her. Liza's water breaks, and Dr. Hannah Asher administers Pitocin to induce labor. The drug triggers violent, tetanic contractions. The fetal heart monitor alerts the room to a sudden drop in heart rate. Hannah stops the medication and forces Liza onto her hands and knees to relieve pressure on the umbilical cord. She prepares for an emergency C-section, but Liza refuses. With a final, agonizing push, a healthy baby girl is born. The piece is short-lived. Hannah finds Liza collapsed on a bathroom floor. A needle, foil, and a lighter lie on the sink. Liza has injected heroin just hours after delivery. When the chief of emergency demands an immediate report to Child Protective Services, Hannah stalls. She reveals her own history of addiction to her superior, arguing that a mother needs support, not just a police report. In the quiet of the recovery room, Liza admits she broke under the weight of expectations. She stayed sober for the baby during the pregnancy, but the internal pressure became a trigger. Hannah delivers a cold truth. Staying clean for someone else never lasts. It only works if she chooses herself. Liza agrees to enter a sober living facility. She hands her daughter to a foster mother, promising to return once she is truly clean. In a final act of gratitude, Liza names the baby Hannah. Hannah stands in the hallway, watching the child leave, knowing the hardest part of the recovery has only just begun. Isaac Collins enters the emergency room on a stretcher following a high-speed car crash. Despite his injuries, he is smiling. After 5 years of dialysis for end-stage renal disease, he finally received the call for a matching kidney. He was speeding to the hospital for the transplant when the collision occurred. Dr. Will Halstead begins a trauma assessment and orders a CT scan. The results show a compression fracture at the L2 vertebra, but Halstead notices a problem. The bone around the fracture has a lytic appearance, suggesting the presence of a tumor. Halstead informs Isaac that he needs an MRI to rule out malignancy. Isaac's excitement turns to desperation. He knows that a cancer diagnosis will immediately disqualify him from the transplant. He begs Halstead to ignore the finding and let the surgery proceed, arguing that a minor fracture should not ruin his only chance at a normal life. Halstead faces a choice between a patient's desperate wish and medical reality. He refuses to hide the finding. He explains that the immunosuppressants required for a transplant would allow the cancer to spread unchecked, effectively killing Isaac. Isaac lashes out in the hospital bed, accusing the doctor of destroying his future. Halstead ignores the insults and proceeds with the MRI and blood tests. The results confirm multiple myeloma. The transplant is canceled. Isaac is devastated, moving from the brink of a cure to the start of a battle with cancer. However, the car accident and Halstead's refusal to compromise revealed a silent killer. He lost the kidney he waited years for, but he gained a chance to treat a terminal disease before it was too late.